Hey everyone, welcome back to the Barking Back podcast. Today we're going to slow things down a little bit and talk a little bit about our senior citizen pets. Basically, as our pets age, their needs are shifting. Sometimes that goes from high energy and play to high quality comfort.
As they slow down, there's some things that you could do to keep them healthy and happy. We're going to give you 5 suggestions. Stick around to the end because the 5th one is very important. Let's get right into the content.
Go for it. Talk about our first segment, Carlos, with a little bit of environmental modifications.
As the dogs get older, sometimes they have joint problems. So it gets harder for them to go upstairs, or if the floors are slippery, sometimes they'll be having difficulty mobilizing. One thing I noticed is putting rugs where the animal walks. When there are stairs, try to put everything that the dog needs downstairs so that he doesn't have to go up and down the stairs. Because sometimes there was a dog that we used to have that he became kind of senile. He would just fall down the stairs because he couldn't see properly. So what we did was maintain him downstairs. Another thing that also helps is, have you ever used those grips on the nails?
Yes. I have seen people put like the toe grippies.
So with those there's like these plastic things you put on the nails, they could grip.
They have better grip because they're like rubbery, so they can stick to the floor. If you've ever tried to rub rubber up onto the floor, it's on their nails, so it helps them grip a little bit better.
Have you had an elderly dog? What have you done?
I personally haven't. I did, my family dog growing up, she was 17 by the time she passed. That was 6 years ago or so. And so I kind of wish I would have had the knowledge. I was still in school at that point. I wish I would have had the clinical foundation to really help her in her last couple of years, because she was fine and happy, but she was just so achy and so painful and never really moved around much. I
did also know a dog that he stopped seeing properly. He would fall in the pool. You have to cover up. For example, if you live on a 2nd floor, they might fall out of the balcony, fall in a pool. So it's sort of like children. You got to block off things that could really go wrong for them.
And other things would be like to elevate their food bowls so that they're not so achy having to lower their neck eating, and give them some really comfortable bedding. We sleep on Tempur-Pedics. Get your doggy, you can go to TJ Maxx and get little Tempur-Pedic beds right off the shelf for your size dog. And that helps with a lot of their pressure points with the way that they lay on these elbows or the knees or the hips.
They start losing hair on the side of their elbows and on their knees if they sleep on something hard.
Awesome. Well, that was kind of our first segment. Our second one is a little bit about internal health and fuel. Some strategies include nutrition. Actually, that's really important. We've had a discussion before about supplements and nutraceuticals. This one, it kind of tapers into there. Also involves some food. When dogs get older, their metabolism does shift just like humans. So they often need less calories, high quality calories, and as well as easy digestible ingredients. Senior formulas are out there that include things like L-carnitine for muscle maintenance. Some of my senior diets, if your dog is not on a diet for a prescription diet for another means, I think a great senior diet is Purina Pro Plan Bright Minds. That's a great one to consider doing. If you want to put them on a joint mobility diet, Purina Pro Plan JM and Hills JD, those are great options. And those are kind of some of my nutritional ones. What about you?
The big 3 is you want the omega-3s, glucosamine, chondroitin. And there's some multivitamins. There's some, for example, NutriCal. It's a little paste. And I've had good results with that. And definitely a balanced meal. We talked previously that sometimes animals, they teach the owner. And they told me one time, my dog hasn't eaten in a month. What that was is like, people would feed the dog when nobody was looking. Like his bowl was always filled with food.
Always filled.
But the dog just figured out. He was like an entrepreneur. He would go here, he would go. If there's children or elderly people,
go straight to them.
Have you ever seen kids eat McDonald's? They eat a fry and give one to the dog.
Give one to the dog. And then they bite part of it off and they end up eating the rest of it.
They're like, the dog hasn't eaten in a month. You see that dog is rotund. It looks like a walking table.
Yeah.
It's defying physics.
Yeah. And so look at, and some of the things that he was talking about, like your omegas or fish oils, your glucosamine chondroitin, those are in a lot of our nutraceuticals. So we'll put in the notes our link to our nutraceutical video. Look for supplements like Dasequin, Movoflex. Look for those ingredients, like also green lipid muscle. Look for ones that have the NASC seal on them. That means that they do their own trials with those supplements. That's really important. And then hydration, also super key. Stay hydrated. Ensure accessible water at all times.
For ocular health, look into OcuGlow. It's a vitamin for vision. My cousin started that company.
Really? Oh, fun facts with Carlos.
To Dr. Mejia.
Awesome. Well, we're going to go on to our next segment, which is a little about mind and body maintenance. Definitely some things we want to consider are modified exercise and mental enrichment. Start us off with a little bit about mental enrichment.
When it comes to the mind, even with humans, you don't use it, you lose it. These animals, if they just sleep all day, they're just going to become dolls. One thing I tried to do with my cat was they sell little plastic rats. You put the food inside and you hide these around the house. Then we lost them. We don't know where they are anymore. I gotta go find them. Then there's little puzzles that the animal has to take the food out. Gongs or the bong.
Like the Kongs?
Kongs.
Bongs, not bongs, folks.
There's something else.
Lord.
You can put peanut butter in that, and the animal has to. I was thinking of Kong.
Get your mind out of the gutter.
Anyways, walking, get the dog stimulated by walking. People that walk dogs live longer because you walk too.
You walk, absolutely. The mobility, keeping them mobile is super, super important. So back up to that mobility. But yeah, modified exercise, low impact. I recently went to a lecture that was run by a board certified surgeon. He said a good 20 to 30 minute walk 2 times a day for dogs, senior dogs, is all they need to keep really good mobility. It's so good for us too. It gets us outside. It clears our mind. We get off our phone. That's great low impact maintenance exercise for our older dogs. Swimming too, hydrotherapy. It's low impact, which is easy on the joints. Same for humans, like going to swim at a gym pool or something like that. If the treadmill hurts your knees or you have issues with that impact, those impact things, swimming is a great alternative. Not necessarily for dogs, for humans, rowing is a great alternative. So I noticed that Fluffy's not on any heartworm prevention. We're in Florida, so I definitely would recommend getting her on some. It's spread by mosquitoes outside. And
yeah, my dog doesn't go outside. It never sees a mosquito.
Well, also I noticed that she's an intact senior dog. Intact dogs are a little bit more at risk of getting like a pyometra, which is a uterine infection, or an unwanted.
My dog doesn't go outside. It can't get a pyometra. It's impossible.
What about an unwanted litter? Does the neighbor's dog have any?
No, it never goes outside. My dog is not into that. She stays in the house. She's not.
I remember you told me she's really, really itchy and she's not on any flea medicine.
But she never sees a flea. She never goes outside. Never.
Yeah, and I noticed we're overdue for our vaccines. So it looks like Fluffy needs our rabies, our parvo, and bordetella. So I think that'll be...
She doesn't need it. She never goes outside. She doesn't need vaccines. Okay. Don't tell your vet, my dog doesn't go outside. Here are some suggestions to be a little more creative. Number 1 is my dog is too small. The mosquitoes don't fly that low.
All of these are true statements we have heard from people. We just took kind of our top favorite ones.
Number 2, my dog doesn't need heartworm prevention because I live in a gated community. So
mosquitoes don't enter gated communities.
Number 3, they told me that I pray to Jesus. The dog can't get heartworm. 4, heartworm is a conspiracy. It's not real. And then number 5, I clean my dog's water bowl. She basically said, my dog is too clean to get any sort of disease. It's never like if the dog is clean, it can't get diseases.
It can't get it. It can't get it.
I've always thought, if you surround a dog with sheetrock and a roof, it's not going to get any sort of dental disease, kidney disease, heartworm disease, infectious disease,
if that was
degenerative disease.
We would live forever.
Sheetrock.
Can you imagine when this race is won? Turn our golden faces into the sun.
What do you consider, how old is a geriatric dog and a geriatric cat?
I think for geriatric cats, for me, I would probably say 10 to 12 and older. For dogs, I do think it varies a little bit on size. Like your large breed dogs, I would say 7. And then your small breed dogs, I would say probably 8 to 10.
How I think about it is a human lives about 84
80 years, yeah.
and a dog 12. That's that ratio, 1 to 7. That means you go through 7 dogs in your life.
Yeah.
You have your little kid dog, your
young adult dog,
middle school dog, you're going off to college dog, that you're an adult, 4 more dogs. And then that's it. It's over. But just like humans, when they get to 7 to 10 years old, things start breaking down. One of the things that you could monitor is blood work. There will be changes to the blood, and you could identify, for example, kidney disease. You could identify anemias, infections. Once a vet knows this, they can make a treatment plan, or they could do preventive measures so that the dog lives longer and with more quality.
And I think that the annual blood work is definitely underutilized. I mean, cost is always a factor. I think prophylactically catching things early by doing wellness panels routinely are more cost effective than when the pet gets sick and they end up needing emergency in-house blood work and all this other treatment. Really, blood work is really a modern gift that we have now for our geriatric and aging animals. Also, I think that it's okay to have wellness exams once a year. Your senior pets probably should be seen twice a year, about every 6 months, because that might help us catch some stuff early too. Are they having periodic weight loss? Are they having a trend of weight loss? Are they having a trend of weight gain? What's the situation? And those things you might catch more efficiently by seeing them every 6 months.
You'll be surprised the things we've seen. It's a perfectly healthy animal. You see the blood work. What is going on here? Now they even have, now people are doing DNA testing.
There are DNA tests out there. Royal Canin has one. I think it's called a Wisdom Panel. Then Embark has one that you can do as well. And then there are certain ones for, like, if you have a purebred cat, like a ragdoll or a Sphinx, you want to see if there's an HCM or hypertrophic cardiomyopathy gene. There's like specific things you can do to look for that. It's pretty amazing.
Because there's certain dogs, breeds that are predisposed to certain diseases.
Yep.
That would be interesting if they could do a genetic panel and just predict this dog's gonna get that, or predisposed to this gene mutation.
I did a DNA test on my dog. It came back that she has like some liver enzyme that her ALT is always going to be low. So if it's ever high normal, that might be abnormal for her. That's something when I do her blood work every year, I watch. Is her ALT high or high normal? Because that for her might be significant for another animal.
When you do blood work, you get a baseline. You're like, this dog's liver enzymes, kidney are this value. Thyroid is this. When there's a change, you're like, oh, you could compare it.
Yep. So I definitely think every 6 months is great. Sometimes for those that really want to go in depth, or for particular breeds, like golden retrievers for me are one that I recommend it, prophylactic abdominal ultrasounds once a year in between the blood work, because Goldens in particular are really well known for splenic tumors and they get really sick really fast. Sometimes doing these ultrasounds, you might catch it early. It is a little bit of an investment, but ultimately your $500 to $600 ultrasound might be significantly cheaper than a $3,000 emergency splenectomy that the dog may or may not live. So these little things that we recommend, and I know it's not financially feasible for everyone, but if you can, they're great things to consider. So segment 5, it's kind of our final focus here, is pain management and quality of life. There's so many options for pain management. I know for me, kind of my go-tos is I'll start them. I try to start them before they become painful if I can. Joint supplements, really good quality ones. Again, you can reference our nutraceuticals. Followed by Adequan, which is actually an amazing injection that, depending on your clinic, you can do at home. It is a disease-modifying drug, which means it actually changes the joint itself. It helps create healthy joint juice or joint lubrication. That's a great thing for pain control and joint health. Followed by more of the pain management, like your non-steroidal anti-inflammatories, your gabapentins, which would be like your neuropathic class or whatever. And then you've got newer ones, monoclonal antibodies like Librela, which I think are a good thing to add on to NSAIDs as needed here and there. And then also, if you got really advanced care in your area, joint injections from specialized surgeons or GPs that are trained in that to do joint injections. Those are also pretty amazing.
I was at a clinic and they had a laser. It looked like that laser from Toy Story. I was like, this is just a little red light.
Yeah.
This. I hurt my wrist one time. I was like, let me try it. It healed my wrist.
Really?
It's like a
It's a non-invasive therapeutic laser.
yeah. So it had like these lasers. I was like, this did work.
That's pretty amazing.
I have lasers, like, especially for those Dotsons that go
Yeah,
paralyzed.
their backs, yeah.
They help them with that. It decreases
Mhm.
like the inflammation. One thing you should notice to see if your dog is in pain is notice when it gets up from a sitting or lying position. You'll see that it gets up really, really slowly. If you just manipulate the knee, the joint, you'll hear it crack, like a little crunchy sound. That means there's a lot of degeneration to that joint and it's painful. Like Emily says, you could, like, for example, carprofen is similar to ibuprofen. You shouldn't give human medicines. These carprofens help with pain and inflammation. Sometimes they're combined with other drugs so that the dog is not chronically in pain.
And actually nowadays, depending on your clinic, sub-Q ketamine injections are also quite popular for long-term pain control.
They're using ketamine?
Sub-Q ketamine. The veterinarian administers
I heard ketamine is good for depression now. They're using that to humans.
Possibly. It's great for pain and it doesn't totally conk them out. So I think it's a great alternative for pain control.
And CBD too.
CBD as well. There's multiple benefits to that. Cognitive health, joint health, skin health. So that's also kind of your natural pathway as well.
One thing you should consider is as the animal gets to his golden years, 7, 8, 9, 10, if you were maintaining the health in its earlier life, if you're taking care of his teeth, proper vaccination, proper nutrition, he's going to be much better off when he's older. Because let's say he has severe dental disease, which causes heart problems. You're not going to be able to sedate that animal and clean his teeth. And what happens is they get abscesses. They get these abscesses in the fourth premolar, and they get a fistula under the eye. You see that a lot
all the time
in animals. Then it becomes a risk to sedate these animals to take out these molars, because it's not only it takes a long time, it's risky on the pet.
Absolutely. You know, our call to action is basically your pet has given you a lifetime of loyalty. Now it's our turn to be their advocate. Take a home tour. Look at your environment. Look at what you have on your shelf for your senior pet. Look at it through their eyes and try to make as many modifications that you can to make their quality of life in their golden years better.
Did you know somebody ran a marathon in less than 2 hours? It's crazy.
I can't run a mile in
26
less than
miles
2 hours.
in less than 2 hours.
That is insane.
Cool. We'll see you next time.